and to design programs, projects, activities to improve the lives of every citizen of our blessed land. Mr. Speaker, I want at this point in time to address the workings of my ministry, the Ministry of Health, Wellness, and the Environment. Mr. Speaker, the current economic environment that we are in warrant examination of how efficiently and effectively resources are allocated in order to minimize wastage, as well as how effectively resources are allocated to achieve maximum output from the programs. Mr. Speaker, in health, we have to deal with the health, the wellness of every citizen of St. Vincent and the Grenadines and other persons who may cross these shores. We always say, Mr. Speaker, that health is a shared responsibility, but more so the responsibility is on the individual. What we are doing is to try to accommodate and assist and present them with the necessary tools and skills and care and treatment in order for us to stay healthy. Mr. Speaker, in my presentation, I will be focusing on the programs, the projects, the infrastructure that is physical and otherwise, and the policies that are guiding the Ministry of Health, Wellness, and the Environment. Mr. Speaker, a lot of times we may hear a lot of critique about the Ministry of Health and Wellness and the Environment, and more so, it's always the case of the Milton K2 Memorial Hospital, where no matter how good or efficient the healthcare workers perform their duties, you'll always have some issues. And as human beings, since we are wrong, we'll have issues, but we'll know how to have to know how to deal with them. And when we are making our criticism, we must be fair also in dealing with these criticism when we're dealing with health. Firstly, Mr. Speaker, I want to look at the National Health Account. The National Health Account in St. Vincent and the Grenadines was produced for the very first time here in the ministry and also in St. Vincent and the Grenadines in 2014. Mr. Speaker, this is an international methodology that is designed to track expenditure within the health system. And this is so over a period of time. Mr. Speaker, this is a methodology that is recognized internationally, as I stated. And international organizations such as the World Health Organization and the World Bank, and by over 100 countries worldwide. Mr. Speaker, the National Health Account answers the following question, and the questions are: where do resources come from? By whom are these resources managed? What kind of goods and services do they purchase? Whom do these resources benefit? Mr. Speaker, it is also designed to use as a policy tool to facilitate health sector performance and management, and to assess how well resources are targeted to health system goals and priority areas, etc. Mr. Speaker, data from the National Health Account exercise will support our efforts to design, monitor, and assess the reforms which we will implement according to the National Economic Social Development Plan 2013 to 2025, as well as the draft Strategic Plan for Health, which focuses on the modernization of the national health sector and provision of sustainable health care with improved social equity. Mr. Speaker, I have been given charge to modernize the health system. And what I have been doing is continuing the works of previous ministers of health to ensure that the reforms that are necessary are taking place. And I am hoping, Mr. Speaker, that by the end of my tenure here as Minister of Health, I will do a substantial job in reforming the health sector if I complete it. And I think I have the capability of achieving this. As my friend from Central Kingston knows well, when the education revolution, I was the one who introduced secondary education here. And he still has he made a promise to drive me around Kingston in an open back vehicle, waving to the people like a beauty queen. So I'm still waiting on that one before I go for him to. Only the last part is true. Okay, all right. So, Mr. Speaker, I know with the help of my trusted professionals within the Ministry of Health, the staff, and all other personnel attached to the Ministry of Health, Wellness, and the Environment, will achieve these goals. Because whatever you achieve, Mr. Speaker, would have to be achieved with assistance from others. Mr. Speaker, the issue of non-communicable diseases stood out on our agenda in 2014. And these diseases we know are clear threats to human existence and are currently the world's leading main killers. We know the diabetes, hypertension, and Mr. Speaker, something that folks didn't really know is that kidney problems and failures also, they have something to do with your diet. I've been told by my doctors. So, and most of the time, persons who have kidney problems are those who are diabetic and hypertensive. So we have to watch our diet, and as I go along, we'll talk about diet and exercise. Mr. Speaker, in non-communicable diseases, half of those who die of these diseases are in the prime of their lives, in their productive years. And as a result, this endangers national productivity. A health professional was designated in 2014, Mr. Speaker, to serve as the focal point for the prevention and management of these diseases. Mr. Speaker, my ministry is serious about the management and prevention of non-communicable diseases in St. Vincent and the Grenadines. In 2014, a National Health and Nutrition Survey was conducted. The results from the survey will be made available in the first quarter of 2015, and it will help in strengthening our surveillance system to monitor and mount the huge fight against non-communicable diseases. And non-communicable diseases, as the Prime Minister in his presentation stated, are lifestyle diseases, the way we live and how we eat. Mr. Speaker, diabetes, with its most feared application, that is amputation, we have appointed a foot care coordinator in 2014. And what this professional will do will be focusing on having all diabetics giving their feet an examination on a regular basis to prevent them from complication which can lead to amputation. Mr. Speaker, I am told by the doctors it's not so much the sores that cause the amputation, but it's when gangrene sets in, so we have to fight against that and always making sure, and the Prime Minister mentioned the product from Cuba, and we are working with the Cuban ambassador and the other health personnel to have that drugs to use for persons with foot ulcers. So, Mr. Speaker, this program will be implemented in all of our health centers in 2015. That is the foot care program. And I'm urging all diabetic persons out there to always visit the health facilities within their community to make sure that the blood sugar level is at the right count all the time. Mr. Speaker, in this regard, we will continue to engage all stakeholders from government, non-governmental organization, church-based organization, or we say faith-based organization, community groups, and social clubs. Because, Mr. Speaker, increasingly, partnership and collaborations are vital in the fight against non-communicable diseases. So, Mr. Speaker, we'll continue to provide support for all citizens of St. Vincent and the Grenadines who have these diseases. And we will stress the importance of self-monitoring and management, because we have to teach the people them that they can do certain things to help to alleviate the problem. Mr. Speaker, tremendous progress has been made in the area of communicable diseases prevention and control. There has been increased access to care and improved health outcomes for people living with HIV/AIDS. Increased coverage of detection of HIV and syphilis among pregnant women, over 95%. An increase in HIV testing and counseling, and a reduction in mother-to-child transmission of HIV, a reduction in the number of HIV-related deaths from 36 in 2013 to 31 in 2014, and we're hoping that that would be lower still. Mr. Speaker, there is now a non-communicable disease coordinator in the ministry, and the professional holds the responsibility for coordinating non-communicable diseases and the HIV/TB response. So, Mr. Speaker, we are ensuring that, as you would have heard in the budget presentation by the Honorable Prime Minister, where he gives a lot of information on what is taking place in health, so we are ensuring that our citizens are taken care of. Mr. Speaker, the National HIV, STI, TB policy was developed and adopted early in 2014. And this policy document addresses HIV, STI, TB. In addition to this, Mr. Speaker, a joint case-based surveillance system is now being developed for HIV, STI, and TB. Mr. Speaker, much emphasis was placed in 2014 on emerging and re-emerging diseases. Ebola comes to mind. This is one that is emerging and re-emerging. But it's emerged recently, Mr. Speaker, again, and we know we're in Western Africa. And for this, Mr. Speaker, when we heard about the threat of this disease, we know we had to respond. And thus a preparedness and response plan was developed. And there is now active surveillance for Ebola at ports of entry, as well as an ongoing capacity building for health professionals in the response to this disease. Mr. Speaker, the Ministry of Health, Wellness and the Environment, in collaboration with the Ministry of National Security and the Office of the Prime Minister, took the lead on our nation's response to the Ebola threat. The working group on Ebola took over the management of the Ebola preparedness process that was started by the Surveillance Committee within the Ministry of Health. Systems have been put in place to protect the citizens of St. Vincent and the Grenadines from the deadly virus. The nation now stands better prepared to manage a patient with Ebola virus disease. In 2014, Mr. Speaker, emphasis was placed on vaccine-preventable diseases. In collaboration with the Pan American Health Organization and our own National Family Planning Unit, the staff conducted a human papilloma virus prevalence and vaccine acceptable study. Mr. Speaker, this is a virus which is associated with cancer of the cervix, papilloma virus. And 500 women, 30 years and over, had pap smears and human papilloma virus screening done. This year, Mr. Speaker, my staff will, and I want to note, prepare for certification of elimination of mother-to-child transmission of HIV and syphilis, conduct NCD, syphilis, hepatitis B and C, and HIV prevalence and risk behavior study among prisoners, introduce inactivated polio vaccine in response to the global polio eradication, present human papilloma virus research findings, integrate HIV care and treatment into primary health care in 7 areas: Chateaubelair, Barrowley, Levi Latham Health Center, Stubbs, Georgetown, Northern and Southern Grenadines. Mr. Speaker, public health officials are increasingly faced with the challenges of dealing with global environmental changes. In 2014, the Environmental Health Program made positive contribution to the lives of all Vincentians, with emphasis on the provision of effective and efficient sanitation service within Kingston and its environment, upgrading vector control monitoring and surveillance activities, which focus on emerging and re-emerging diseases, and also contributed towards an enabling environment for economic and social well-being. Also redefining and improving environmental health regulatory functions in food safety and hygiene, water quality and waste management. Mr. Speaker, the staff at the Sanitation Services Unit clean Kingston and its environment daily. There was, however, an increase in the workload of the sanitation employees owing to the proliferation of refuse and the increase in entertainment activities within Kingston and the suburban areas. And Mr. Speaker, this is something that I think that the Ministry of Health and the Town Board and other persons would have to try to address, with when there are entertainments around, the amount of litters that are strewn on the street. Sometimes you have garbage collection containers, what people don't throw them inside there. So, and Mr. Speaker, no one can deny the exceptional work done by the sanitation workers. And we're always seeing this at the end of Carnival, when persons who enter in Kingston about 6 o'clock or even a little earlier after Carnival would want to know if it's the same Kingston that they saw the night before. Mr. Speaker, 2014, especially in April, presented a new challenge with respect to the emergency of a rapid mosquito-borne disease called the chikungunya virus. Mr. Speaker, it was the first time our vector control workers and public health officials were confronted with this virus, and all of us here in St. Vincent and the Grenadines. So the success of the chikungunya program did not come without negative consequences, Mr. Speaker. Some persons criticized the use of fogging in communities, and others were persuaded that chikungunya is not a mosquito-borne disease. And so some people didn't bother, and that is why a number of persons were affected. You know, and I must say it's not in St. Vincent alone that persons had that perception. Because when you go to a regional meeting or PAHO meeting, you'll hear some story because it was spreading so rapidly. And you know, we had a soca song, very humorous and entertaining one, where the artist called on the Minister of Health not to blame the poor little innocent mosquito. And he called on some businessmen and say, you know, they were the ones responsible. But we know, you know, the calypso. But most of the time we want to urge persons, when the health workers or the health officials make a statement and tell you about certain things, they know what they're talking about. So let us heed their call and be prepared. And Mr. Speaker, during that time, I must say how well those persons at the Vector Control Unit work. And when we were confronted with this disease, the Minister of Finance promptly gave us some more resources to deal with the issue, especially in buying those chemicals that were needed to help eradicate or reduce the mosquito number, and also to present schools, clinics, and other areas with brochures or leaflets as how to manage the disease. Mr. Speaker, our rodent control monitoring and surveillance program noted increase in rodent infestations, especially in commercial Kingston and the rural communities. The rodent team, however, managed to prevent significant outbreaks of rodent infestation in our institution. Mr. Speaker, recognizing the rodent challenges and its implication for lives and livelihood, government has pledged and committed additional finance for 2015 to help with the rodent population. Mr. Speaker, we know there are some farmers who are crying out, and as the Prime Minister stated, where you have water and food, you'll always have rats, you know. So we have to, while we have those commodities, we have to try to starve the rats and try to see how best we can control. One of my colleagues said when you see them running around Kingston, they are so large that you could put a saddle on them and ride them. Rats. Huh? Beware of rats, right? That is what we are saying. That's why we are saying the rodents population, we are trying to see how best we can get rid of them because they spread disease as well. And as I stated, yes. And we have, as we say, we're going to mount a program with the Ministry of Agriculture because they are affecting the agriculture belt as well. So not only in Kingston, and we want to urge persons to, especially those persons with restaurants and food houses, to try not to let food go down the drain pipes so that these rats could get readily available food. So in the eradication of rats, all citizens are also responsible to help in that regards. Mr. Speaker, this year the staff in the Environmental Health Department will implement the National Water Safety Plan, strengthen the potable recreational and wastewater monitoring program, implement the proposed wastewater pilot project at the Belle Isles Correctional Facility, initiate the development of wastewater policies, and review adaptation of national wastewater standards. Also, Mr. Speaker, the ministry will continue to host medical missions here in St. Vincent and the Grenadines. And these medical missions provide medical enhancement and care that are already being provided by our staff and our own professionals. But as always, we can always use the assistance and help of other persons with other skills that we may not have, with more enhanced skills than we have. Mr. Speaker, we continue to partner with some of these missions and other persons like the Lion Clubs to increase ophthalmological services. That's what the Lion Club assists us with. Other organizations have been providing service in ENT and dental services. Mr. Speaker, we're talking about ENT. This is a field in medicines that, we, not only myself, but other ministers of health have been trying to get persons to study, but it's probably not a sexy subject, really. So it's one that maybe someone who is in the medical field already would have to take up this, because we only have in the country, I think, one ENT person. So the young persons out there who may be listening, and any one of us inside here, you could start encouraging someone who wants to do medicine to take up the service of the ears, nose, and throat aspect of this medicine, this profession. Mr. Speaker, our own Vincentian, Dr. Stephen Anton, who is based in the USA, he brings a team annually to provide gastroenterology services to St. Vincent and the Grenadines. The World Pediatric Project stands out as our gold partner, Mr. Speaker, providing outstanding service to Vincentian and children, not only for St. Vincent and the Grenadines, but the OECS and Barbados. Mr. Speaker, recently the 100 team visited St. Vincent and the Grenadines from the World Pediatric Project, which was started in 2001. So we have to give them a lot of thanks. As I said, it's our gold project. Last evening, you would have heard the Prime Minister mention about the number of persons who would have been evaluated and treated, whether surgery or the treatment, through this program, and the cost. Over 6,000 persons in Vincent and the Grenadines and the OECS, Barbados, recently, and over $30 million would have been provided to these individuals, not only the patients, but also the parents. And Mr. Speaker, one thing that we must note here is that when these persons come from the OECS, the Milton Clayton Memorial Hospital and the Ministry of Health and the government of St. Vincent and the Grenadines don't charge them 1 red cent for their stay here in St. Vincent and the Grenadines and at the hospital. So that is our contribution, Mr. Speaker, to the health and wellness of our OECS and other Caribbean colleagues, because we are receiving service also, our citizens from time to time receiving some free services in the OECS. No, Barbados, a couple persons recently, but not as full as the other OECS nation. We don't charge. Oh, sorry, I didn't get you. I didn't get you. Yes. Yeah. Yes, yes. And mainly these are the children, from, I think, to about 20, early 20s. Yes, early 20s and below. And Mr. Speaker, the WPP, they provide specialist service in pediatric cardiology, general surgery, orthopedic surgery, physical therapy, urology, plastic surgery, ophthalmology, and neurosurgery. And I gave you the figures a while ago and what we in St. Vincent are doing for our Caribbean colleagues, especially in the ECS. Mr. Speaker, in the area of nutrition, my staff met with the Ministry of Education in May last year. And this was to plan the policy framework to implement the joint Ministry of Education, the Ministry of Health, the Mustique Charitable Trust School Nutrition Project. And in May 2014 also, the draft nutrition standards for school meals programs were prepared. And this was done in July, where more than 100 employees in the school feeding program were trained in basic nutrition, menu planning, food safety, and draft nutrition standards for school meal programs as part of the joint Ministry of Health, Ministry of Education, Mustique Charitable Trust School Nutrition Project. And several tuck shop workers, Mr. Speaker, were also trained. You would have heard mention being made, especially the Prime Minister in a presentation down at Clare Valley when he opened the clinic, and on another occasion when he talking about the meals that are being provided at schools and the low cost for these meals, 50 cents in some school, $1 in some others. The parents and other stakeholders are buying into this program. They provide food stuff like what they get produced from the lands and so on. So these workshop and training, they were implemented to assist these caregivers, these persons who cater in the kitchen, who cook the meals, different methodology in preparing meals for the children of our nation. So, Mr. Speaker, in October 2014, an additional 64 school feeding teachers received training in basic nutrition. That is after the 100 that we talk about. And in menu planning and food safety. A remaining 24 schools food service workers were trained on Tuesday of this week. And the 64 school feeding teachers received training in the draft nutrition standards for school meal programs yesterday, Wednesday. Mr. Speaker, with technical assistance from the Pan American Health Organization, PAHO, and the Caribbean Public Health Agency, work continued on the National School Nutrition Policy and Plan of Action. This activity involved over 40 school principals, health and education officials, and other stakeholders. Additionally, Mr. Speaker, individual nutrition care was provided to 56 children with abnormal nutritional status, that is stunting, wasting or overweight, obesity, and 43 hours of follow-up nutrition and fitness program conducted for the Greg's community from March to May, and 43 hours nutrition education and food utilization program was conducted for the Gome Daphne community from October to November 2014. So, Mr. Speaker, we're not only doing these things within the school and in the health facilities, clinics, and so on. We are carrying it to the communities so that community workers where the children come from, they would know what to do at home as well. Mr. Speaker, also in this program, more than 90 inpatients at the Milton Cato Memorial Hospital were referred for and received medical nutrition therapy, primarily for chronic non-communicable diseases and associated complications. For the same period, 180 outpatients receive medical nutrition therapy based on referrals from medical practitioners as well as walk-ins. And referrals are now received from district clinics, mental health, and ophthalmology outpatient clinics, and all patients seen by the clinical dietitian receive individual meal plans. Mr. Speaker, a nutrition screening tool has been developed and will be piloted at the Milton Cato Memorial Hospital. So as we continue to emphasize good eating habits, the professionals in the area of nutrition will in 2015, Mr. Speaker, do the following, and I note. Complete the final report of the nutrition module of the National Health and Nutrition Survey. Complete the National School Nutrition Policy and Plan of Action. Complete the remaining components of the joint Ministry of Health, Ministry of Education, Mustique Charitable Trust School Nutrition Project, and provide training in diet, therapy, and nutrition screening for nutrition units and hospital dietary department staff, etc. Mr. Speaker, great strides are being made in the area of mental health, particularly as we roll out the 10 TDF project. The complete refurbishment of the site at Villa began in the third quarter of last year. And staff and clients and services are now temporarily relocated at an appropriate site in Orange Hill, with outpatient services now being held at the Stubbs Polyclinic. So, Mr. Speaker, I understand that they are so enthralled and thrilled at Orange Hill that the ease at which I get them to go out there, I don't know if I would have that ease in returning them to the new facility. Yes. So, Mr. Speaker, you see, so our mentally challenged citizens, we have to ensure that, we look after them properly so that they can be a part of society, And I think that I must commend the majority of Vincentian, maybe there are a few exceptions, but the majority of Vincentian are not skeptical as they were before we were posed with mental illness, and they are not treating them as scornful and outcasts as it used to be, because when you do that, you're not helping the situation at all. So, Mr. Speaker, we are making huge efforts to improve the overall quality of mental health and mental health services for persons suffering with mental ailment and disorder. So, Mr. Speaker, during the year, efforts will be made to provide modern, secure, and appropriate facility, equipment, and administrative service for the management of persons with mental disorder, and to transform the mental health center into a therapeutic community that is focused on treatment, recovery and aftercare, and to strengthen the outpatient services into other communities, and also to develop guidelines for procedures, intervention to ensure the application of safety of our clients. So, Mr. Speaker, we are looking after the needs of all the patients and all the people of St. Vincent and the Grenadines. We have our challenges. Nothing would be 100% all the time in any area. Mr. Speaker, in the area of secondary health service, and I want to refer here to the Milton Cato Memorial Hospital. There is now a fully refurbished and furnished pediatric department at the Milton Cato Memorial Hospital. This was achieved, Mr. Speaker, at a cost of $1.2 million, including new equipment and furniture, And this was essentially a project funded by the Friends of Mustique and the World Pediatric Project. And this project also, Mr. Speaker, was in partnership with the Sick Kids Initiative. Mr. Speaker, permit me now to highlight some of the innovations and achievements at the Milton Clayton Memorial Hospital in 2014. A Sick Kid Caribbean Initiative patient care education rounds was delivered through telemedicine monthly for nursing staff. Doctors and nurses participated in telemedicine activities monthly. Nurses participated in teleconferences on the concept for the pediatric hematology, oncology, nursing education, and also aspects of the initiative. 3 brand new industrial washers were installed at the main laundry. A brand new autoclave donated by PAHO was also installed. Renovations under the 10th EDF project commenced and are in progress. A new CT scan machine was installed and commissioned in November 2014. 43 nurses completed the requirements for award of the BSc degree in nursing. 2 portable X-ray machines were acquired in August 2014 and commissioned shortly afterwards. Mr. Speaker, in 2015, the vision the nation will see the Milton Clayton Memorial Hospital completing the completion of the infrastructure development, which I mentioned earlier on under the 10th EDF, a general facelift of the Milton Clayton Memorial as a consequence of our collaboration with PAHO, that is the Pan American Health Organization, the reintroduction of the oxygen plant at the Milton Clayton Memorial Hospital. This was damaged, Mr. Speaker, during the flood in 2013, Christmas Eve. The recommencement of fluoroscopy services, the acquisition of a digital fluoroscopy machine, the upgrade of the computed radiology system, further training for departmental and ward sisters in leadership and management, implementation of a monitoring program for nurses, a comprehensive review of policies and protocols, and the continuation of surveillance and audit and patient satisfaction questionnaire. Mr. Speaker, we continue to strengthen our community health service in 2014. We were able to maintain the national immunization coverage for children born to 1 year of over 95%. That's born to 1 year. From 1 year to 5, it would have been 100 or thereabout. But between birth and 1, so those 3 persons, there are some persons, Mr. Speaker, who have this idea that their children should not be immunized, but to get them into the school system or even into a preschool in some area, you have to immunize your child. So that's why the figure there say over 95% from birth to 1 year. But after that, when they realize the children have to, some people turn up. So, Mr. Speaker, the school health program was again successful, with physical assessment conducted on over 95% of primary school entrants and primary school leavers. There was audiology, dealing with the air, screening in 68 preschools and 21 primary schools and 26 health centers, where a total of 2,863 children were seen, 55 referrals were made. So, Speaker, in our continued attempt to build capacity, several members of staff received training in mental health, in primary health care, family planning, field epidemiology, case investigation for communicable diseases, disaster management. Mr. Speaker, this country, we now turn to pharmaceutical. This country, Mr. Speaker, remains the largest buyer of pharmaceuticals and medicals through the OECS PPS accounting system, and this is accounting for 25% of total purchase of the OECS. through the Pharmaceutical Procurement Service. Mr. Speaker, our Pharmacovigilance Center is the most active in the UECS, and our Pharmacy Council continues to work towards proper regulations of the pharmacy practice in St. Vincent and the Grenadines. The Central Medical Store began using the Regional Electronic Procurement System, the EPPSS, with corresponding improvement in the Health Information System functionality in 2015 to continue. Mr. Speaker, in 2015, the HIS, which is the Health Information System, here the Prime Minister mentioned that we're implementing this system to cut down on wastage and so on. So in 2015, we'll provide training in inventory management for our pharmacists during the first quarter of this year. We'll begin a clinical pharmacist intervention program by the end of the second quarter. We'll pilot the project to monitor the use of antimicrobials in the public health system by mid-2015. We'll streamline all medicines, medical supplies, and medical equipment under the ministry. Mr. Speaker, St. Vincent and the Grenadines Health Information System represents the modernization of the public health sector by the Ministry of Health, Wellness, and the Environment. Final implementation of this program, Mr. Speaker, that is the St. Vincent and the Grenadines Health Information System, is expected to link the ministry's main offices uptown with all public hospitals, public laboratories, and district clinics in the country. And the information gleaned here will be synchronized on a near real-time basis. The focused implementation of the St. Vincent and the Grenadines Health Information System is expected to lead to improvement in the healthcare service delivery for all patients, healthcare reporting and record maintenance for the ministry, and potential cost savings for the government. So, Mr. Speaker, I am pleased to highlight the following innovation and achievements in 2014 in the area of health information system. There was an expansion of the telemedicine program for primary health care, including the prisons, 100% electronic use of the SVG-HIS for requisitions at all public health facilities, appointment scheduling through the use of the health information system. More than 1,200 healthcare workers were trained to use the system by the end of 2014. The system is currently implemented at all district health facilities, 100% rollout for primary health care, and approximately 60% implementation at Milton K2. And the policy and legislative framework was completed. So, Mr. Speaker, as we move forward in 2015, we are hoping to have the 100% rollout of the St. Vincent and the Grenadines Health Information System at the Milton K2 Memorial Hospital, and also the completion of the reporting platforms to inform senior management for policy decision making, and the strengthening of the HIV surveillance system, and also the pharmaceuticals and supplies management needs, and the completion of the draft policy to drive the adoption of the health information system. Mr. Speaker, we continue to receive technical and financial assistance from the World Health Organization and PAHO, with a focus on priority health needs as defined by the ministry in its health strategic plan. The biannual amount of $725,000 from this organization will be used to finance the priority areas of the ministry according to the work plan. Mr. Speaker, we received considerable amount of assistance in the aftermath of the Christmas Eve floods of 2013 through much source reduction activities in our attempt to control and eradicate the chikungunya virus. I talked about it earlier on. The PAHO, WHO, APAHO, help us to procure and give us a vehicle, provide us with equipment and training of staff in emergency supplies management. And these contributions, Mr. Speaker, are valuable at more than, valued at more than $500,000. And they also include some other materials and equipment. The vehicle we purchased, Mr. Speaker, is a double-deck cab. And this is at the vector unit used for fogging, purchase of insecticides and fogging materials to be used at the vector unit. They help us, that is after the aftermath of the Christmas Eve of 2013. Purchase of diesel and rental of vehicle to be used by insect vector control unit staff in their fogging operation for a 6-week period. They help us to purchase 3 water tanks for the Milton Cato Memorial Hospital, improve any electrical works on the maternity ward at the Milton Cato Hospital, purchase of electrical generator, purchase of AC units, other critical equipments, and painting of the facility. So my ministry, Mr. Speaker, look forward to the continued support from PAHO as we make huge efforts to improve the health sector in 2015. So we want to thank PAHO sincerely for their contribution, and they have been contributing well to this nation. Mr. Speaker, the Republic of China, Taiwan, under the Civic Development Fund program, has purchased several critical pieces of equipment for the laboratory at the Milton Cato Memorial Hospital, including an ACL 7000 coagulation analyzer, a Beckham Coulter HMX. Now I want to tell folks I'm not a lab technician, so if you want to know what these are, you'll have to go to the hospital and ask the lab technician. They show me them and they are used for different tests that you do and so on, but which is for which test, I can't tell you here, not being a doctor and a lab technician. But I'll just tell you the pieces of equipment and hematology analyzer and an Abbott Axim immunoassay analyzer. And Mr. Speaker, this new equipment has restored the laboratory to operating at maximum capacity. Several tests that had to be outsourced to private institutions are now done at the laboratory. And I know in previous times, a person would have had concern and asked about these things, My colleagues from the other side would have asked about them and so on. So now we have, yes. Yeah, well, I never denied anything. Okay, yes. And I know that, okay. Mr. Speaker, the contribution of the Civic Development Fund for 2014 was in the sum of $557,000. That is the fund that from the ROC that I just spoke about. Mr. Speaker, for this year, approval has been given for the sum of $600,000 to procure more laboratory equipment capable of more advanced testing and less process time. So we'd have some more machinery and equipment that would help us not to send away some of the stuff that we have to send away at the moment overseas and have to wait, and the time would be shorter. Mr. Speaker, the mobile blood bank is expected also to be retrofitted to operate at maximum capacity. And I here want to urge my colleagues and others who are listening to be a blood donor, voluntary blood donor. That I have been doing that since the year 1978 and continue to do so. So it's always a nice thing. Fellas were wondering why I've been giving. I always say, I understand that most ministers of health and doctors are always free to. Yeah, so that's why you're having the mobile blood bank. So I hope to have it operating before my time is up, so I can go around with them and seek out some of you guys to get you donate blood to the hospital. We always need blood, especially for around Carnival and Christmas time. Not for young people, but you might have the kind that some young people want. You're all right. But I'm urging you, well, help me to get some of the young people to do that. Mr. Speaker, the Urology Department will also receive equipment which will assist in early detection of patients with renal diseases, etc. And the government of St. Vincent and the Grenadines just recently signed a financial agreement through the 10TDF project, the modernization of the health sector project with the European Union, with a total budget of Euro 8.3 million, 6.69 from them and 1.61 from the government of St. Vincent and the Grenadines, with the whole modernization of the health sector. But in July last year, Mr. Speaker, an additional financing agreement was also signed, a cost of Euro 5,524,511, and this adjusting the total allocation to over 11 million euros and shifting some components of the agreement. But Mr. Speaker, the overall objectives remain the same, and that is to improve the delivery of healthcare services. And this project, Mr. Speaker, is designed to enhance the efficiency, effectiveness, and sustainability of the country's healthcare delivery system, particularly as it relates to the prevention of chronic, non-communicable diseases. And that is one of the diseases, Mr. Speaker, you'll hear people talking about often, the non-communicable disease, the one that we have most control over as individuals.
And you have 15 minutes to conclude.
Okay. Mr. Speaker, the modern medical complex is being constructed to offer hemodialysis treatment and related services. You heard last night it is 92% complete. And I am still confident, Mr. Speaker, that the date that I was given sometime last year, that by May of this year, we will complete that facility and begin operation in September of that year. Allocations have been made in this regard, Mr. Speaker, for budget for recurrent expenditures, staff, utility wages, etc., to facilitate the daily operation of this facility. Mr. Speaker, we established a health disaster management unit last year to develop safer communities, and we hope that we will suffer fewer deaths, physical injuries, and psychosocial trauma as a consequence of disaster. Mr. Speaker, in the environment, we know that climate change has been one of the many topics that is being talked about throughout the world, and also the preservation of the ozone layer. In preserving the ozone layer, Mr. Speaker, in the year gone by, we launched 2 educational handbooks, one for students and the other for adults. And we're hoping to collaborate with the Bureau of Standards to develop industry standards for the safe handling, transportation, and storage of refrigerant. Mr. Speaker, the National Biodiversity Strategy and Action Plan, which is now being developed, a rapid reef assessment was also done under this project, and the data collected would be used to manage marine area, and we want to design the southeast coast as one of the marine managed area in an effort to combat land degradation, the coastal degradation, and so on. Mr. Speaker, the ministry has implemented an OECS project funded by the U.S. Agency for International Development, which has almost completed installing rainwater harvesting system on 5 disaster shelters and also at the Liberty Lodge Boys Training Center. Mr. Speaker, that project has also increased the storage capacity of the desalination plant in Paget Farm, Beckway, from 20,000 gallons to 60,000 gallons. And we are hoping that by 2016 to complete installation of lines so that the community can access water at their homes. And Mr. Speaker, we have also made proposal, Mr. Speaker, for additional rainwater harvesting system under this project, and we are awaiting the final approval. Mr. Speaker, we are hoping that this reverse osmosis desalination project that we have in Paget Farm, we can get funds. We are trying to get funds to have this project in other communities, in other islands within the Grenadines. Oh, yeah. All right. Mr. Speaker, no, I'm saying all right, you know that. Yeah, well, I'm telling you, all right. I say, okay then. All right. Mr. Speaker, so the Ministry of Health, Wellness and the Environment, Mr. Speaker, is doing all that is necessary and desirable to ensure that the health and wellness of our citizens are in the best condition that it should be. And I want to thank the professionals within the Ministry of Health, the top management team, the senior management team, the other subsectors and other committees that are assigned various tasks within the Ministry of Health, Wellness and the Environment for the tremendous services that they have provided over the years. And I want to urge them to expand on that and to let us manage the facility in the best way possible so that we can get maximum results from all our programs that we have, so that the citizens of St. Vincent and the Grenadines and those who may use our facility will benefit from all these efforts and resources that we are putting in. Mr. Speaker, I want to say here that persons in the month of February, coming to the end of February, you may go to the Maracay Valley and you may not see operation of the Levi Latham Health Facility there. We are moving those operations to the Evesham clinics to accommodate the restructuring, the renovation, the building of the polyclinic in the valley. But clinic would be held downstairs, the magisterial court, and Bragser would be doing some repair work there for us and retrofitting that. So the clinic would be done still in the heart of Mespo, while the Levi Latham, it's a 12-bed facility, would move up. We have the space and everything there. It's a big clinic we have up there. And yes, not in the budget here of 2015, but I have heard the call from the member for Central Kingston, and I'd ask my official to look into one of those, as we call them, one of the have all of the basic facility there in and see where up there. Maybe you could help us locate a building there and we see how we can arrange that, But we'll discuss that with the healthcare professionals and so on. Okay, although we have an outpatient down there, but I know the outpatient that you have to accommodate not only from Kingston but other people elsewhere. So we'll see what we can do for the folks in St. Vincent and the Grenadines. Yes. So that, Mr. Speaker, would was other area, a town hall meeting was held. Mr. Speaker, how much minutes is it? 10?
No, we have 7.
7?
7.
Okay. 7. Mr. Speaker, in the constituency of East St. George, we have done a lot of things there from since 2021 to 2014, and we'll continue the works there in this year. There would be further upgrading of the Calico playing field. Mr. Speaker, I wrote the Minister of Sports and the National Sports Council and told them that I'm not happy with the lighting there. It was better before they changed the lights, and they have the lights. And I asked them to get that because some of the lights shining all up in the air, all in all directions instead of on the field. So I want that one addressed, but we'll improve upon the fencing and try to see if something can be done with the surface. As you know, Calico, like some other area below sea level, and there are certain sections that water stays on for a long time before it's reduced. Mr. Speaker, recently we have upgraded the facility of the community college, the health center in Glen, which is most of the time we say Calico, has been given a facelift. Roads, as we know, throughout the country, are our biggest concern, and some work has started, even in the end of last year and the beginning of this year in some communities. And we'll have more road works being completed in this year. I know that a number of persons are asking and calling for certain roads and their roads to be fixed. We'll do those things. And all the other amenities that are necessary.
I don't think the stenographer is hearing me.
Oh, sorry.
Drop your voice somewhere.
Okay, I dropped my voice. Sorry. Yeah, I was saying that roads we know throughout St. Vincent and the Grenadines, we have some concern in some areas, and that is being addressed at presently and would be addressed further during the year. I was saying that the facility, the community college, received a boost there with the opening of a $30 million program where we expand on the community college. And we continue to provide assistance to persons in all areas, in the social areas, material, housing, education, health. I mentioned that the health center in Glen, as we say, Calico, has been given a facelift as well. And the work continues, Mr. Speaker. How it going? There were four remaining? Yes. All right then. Mr. Speaker, as most folks, I heard, yes, I heard the Honorable Leader of the Opposition saying the last budget before the election and the next one he would be presenting. But, I guess at this junction, this point in time, I have an advantage over that this is my last budget before the election. I can't say so for sure. I can't say that. What I could say for sure is that I would not be contesting the next general elections because whenever it is being called. That's the one I can say for sure of, because I have already told the central executive and the leadership that I would not be, after 3 years successful, no one pushed me out. So you see the 3 terms, you see the thing about it with me. Yeah, and I am a winner. Yes, and I am bowing out. Right, not out. Yes. No, I would. No, not that I know when to bow out, but.
I remember, I didn't stop the clock when you interrupted, so you have another 3 minutes to complete.
So, Mr. Speaker, whenever, that and the central executive, the national council, my constituency council, and all those persons accepted my proposal, and they did indeed nominate and elected the individual to contest the next general election in East St. George, and that is Yes. So, Mr. Speaker, I think I have handed over to a worthy competitor as well. And no, I'm saying I hand over to a worthy competitor, who would do a good job as well in that constituency. And Mr. Speaker, I know I would have another opportunity, but let me thank all those persons within. I didn't say that. You see, in this party, Senator and member for Central Kingston. No, Major. Yes, Major, yes. Yeah, in this party, we have a process where we call renewing, refreshing, rebuilding, and so on. Yeah, so those are some of the things that we consider in this party, when you are... In
his language,
fresh legs. Fresh legs, because, when you, in my case, the legs still good, but they're still fresher legs, because that's around the time when I came in, very fresh and everything, And I know that the Unity Labour Party will continue to get the same support that I receive in East St. George on an ongoing basis. So, Mr. Speaker, honorable members, I want to support these estimates, budgetary estimates presented by the Minister of Finance, and to say that they are budgetary estimates, when you look at them, that looks after the needs of all Vincentians in all sphere of life and workings. And whether it's my colleague telling me sit down, when I tell him to sit down, he will sit down too. And I hope that those persons who are responsible for implementing these policies, programs, and activities that are outlined do so efficiently, effectively, and efficaciously. And let us continue to work towards building St. Vincent and the Grenadines. And while we may have our individual political differences, all of us have to work together. And I want to tell her again, let us look after our health, and help me please. I say I am pleased and enjoyed about with 2 persons, especially here, it could be 3, in Parliament. That is the Honorable Daniel Cummins and Jomo Thomas, how they keep those figures over the years, Major, to some extent, he go up and come down every now and then. But, so I want to see, and the Speaker has, I was talking about the members, otherwise, I should say in Parliament, and the Speaker, so, and I noticed that I see Minister Daniel is trying to compete with the Prime Minister, which is doing well. And I also have been shedding some pungs as well, because when I see those fellas, I get envious and want to, I can't allow, persons who are win 50 more than me to get down below me quicker than I can, and I be the Minister of Health. So in seriousness, I want to draw attention that our health is our shared responsibility, yes, and Maxi. And we in the health service helping you along that line to ensure that you have proper health. Don't wait till the last minute. Mr. Speaker, last December is the time when we have more persons with diabetes and hypertension rising, because they tend to focus on all the goodies that are wrong at those times. And no matter how the healthcare workers tell them, so we expect that. So that is one time in the year when the health service is really being pushed and the professionals are being walk to the limit to ensure that safety. But all those are part of life, but we're hoping that people will take control of their life. I'm much obliged, Mr. Speaker.